Welcome to It's Your Case, presented by VetCT.com. I am Amy Zalcman, your radiologist on demand for this week. Today's case is a 4.5-year-old King Charles Spaniel who was unfortunately run over by his owner. His lung sounds are dull and his respiratory effort is increasing. We notice that there is gas in the pleural space. This is consistent with a pneumothorax. In lateral recumbency, the middle lung segments may not have the same capacity to expand with the presence of pleural gas. This can result in atelectasis of the right middle and the caudal subsegment of the left cranial lung lobes. When these lung lobes are atelectic, they cannot appropriately buoy the weight of the heart. And therefore, we see that there is displacement of the apex of the heart, resulting in the cardiac silhouette falling dependently away from the sternum. This creates a gap of the silhouette and the sternum where we observe air opacity. We also see irregular stranding of soft tissue in the pleural space. Frequently with pneumothorax, a small volume of hemorrhage can be observed. Since blood can clot, it can also create unusual shapes that don't necessarily follow the typical pattern of the pleural fissures. There is increased serosal contrast in the mediastinum, which heightens our ability to assess the margins of the trachea. We see gas tracking along some of the great vessels. Additionally, in the cranioventral mediastinum, we have a more heterogeneous appearance of both soft tissue with small gas foci. This is consistent with both a pneumomediastinum as well as suspected mediastinal fluid, which likely represents hemorrhage. In the left caudal lung lobe, we identify that there is increased opacity that is consistent with alveolar pattern due to the presence of an air bronchogram. In the right caudal lung lobe, we see that there is increased overall opacity without complete loss or effacement of the vascular borders. These areas indicate that something has been added to the lung, and in light of recent trauma, contusions are our highest suspicion. On the right lateral view, the cardiac silhouette is relatively normal for size. However, the pulmonary vasculature is relatively narrow, and the caudal vena cava as well is somewhat narrow. This case represents a common collection of traumatic changes in the thorax: pneumothorax, pleural hemorrhage, pneumomediastinum, as well as hemomediastinum, pulmonary contusion. The small vessels in the small caudal vena cava also heighten our suspicion for hypovolemic shock associated with the trauma. Other things to investigate are rib fractures. None are identified here, but based on the curvature or shape of the ribs, typically the point of tension is at the arc. For this reason, rib fractures are often most commonly observed on the ventrodorsal view. Both pneumothorax and the pulmonary contusions that we've described can manifest as increased respiratory effort. If rib fractures were present, the associated pain could also contribute to an irregular respiratory pattern. Be sure to check out the full report associated with this case. Thank you for listening, and remember, it's your case, so please post your questions on social media.